Hey, what's up, everyone? It's Dr. Glenn Vo. I am super excited to have this young dentist on. So, before we get into this episode, I'd like to give a shout out to one of our sponsors, Addit. Addit is designed and engineered specifically for dental practices. It integrates with most of the practice management softwares on the market, and it is the only software solution that integrates voice over IP, text messaging, emails, patient forms, online scheduling, analytics, reviews, payments, and so much more. So reach out to the guys at Addit and ask for the Nifty Thrifty deal. Now, you might have seen her around, Dr. Alan Stern heard her on his podcast, probably seen on social media. And if you are a fan of the Dental Download podcast, then you know exactly who I'm talking about. It's Dr. Haley Schultz. Haley, what's up?
Hello, thanks for having me. I'm super excited.
Well, I'm excited to have you here because, I would say I wouldn't say OG like Dr. Alan Stern OG, but I'm a veteran. I'm a veteran, been practicing for about 16 years now, but you have been practicing for how long?
Couple months. I started back in
Couple
June.
months.
Yeah.
I love it. And I was excited to have you on because, a lot of times, and you've seen in all the different social media groups and also on message boards, I mean, doctors, if they've been in there for a while, they kind of forget how it was starting out. They kind of forget like all the obstacles and all the different things that new grads like yourself face. And sometimes I think like, hey, you guys could practice a little, give a little empathy there because you remember how it was, but when you're in the trenches for so long, you forget about that. The first thing I want to start off with is, you started this podcast, actually your podcast, the Dental Download, while you were in dental school, correct?
Yeah, even a little bit before dental school, like a couple
Wow.
months before I started it at the
Well, tell us
pre-dental.
about that.
Yeah.
Yeah.
Yeah, so I started the podcast because I wanted to make YouTube videos actually. So I was making YouTube videos, but at the time there was kind of time restrictions. You couldn't make them too long. So I started the podcast as a way to share advice and kind of mentorship with students that were years behind me in school in more of a long form way, like 20, 30-minute episodes. And it grew with me through dental school. And I was able to share what being a first year student was like, into second year, into starting clinic, into finding jobs, taking boards, all of those things that kind of led me to where I am today. And I have guests on my show, similar to conversations that we're going to have later,
Yeah.
where people share their journeys in dentistry as well. So lots of ways for people to figure out what avenue they want to take when they're a dentist and learn from other people's successes and failures.
Well, the podcast basically just grew along with you as a pre-dental student to a dental student to now actually a first year associate. And I'm imagining it's going to keep on going. And I love that because there's like definitely time frames right there that people, no matter where you are in your career, they can relate, right? So if it's a pre-dental student, they can jump in and kind of follow your earlier videos. If they're in dental school, they can kind of get a preview or relive some of the things that you went through. And of course, being like a new associate. Let me ask you this. So again, we're kind of backtracking a little bit here. Where did when you started this journey as a pre-dental student, where'd you do your undergrad? Where'd you go to dental school? And where are you currently now working as an associate?
So the short answer is all within Michigan. So I went
Okay.
to Michigan State University and then I went to University of Michigan for my dental school. And I moved from the east side, more metro Detroit area where I grew up, to rural Southwest Michigan where I'm working now. So that was kind of the major change of pace, but all
Yeah.
still within the state of Michigan for me. I love
Okay.
it
So
here. So
so you didn't go down to Ohio. So you stayed kind of like loyal, right? A little bit. It's not like you went to Ohio State or something like that. Now, how was that? Now, just me being a Texas guy, I went to Baylor College of Dentistry, but like halfway through, it became Texas A&M College of Dentistry. So there was a kind of like a dilemma there. It's like I'm proud of my dental degree, but man, did it have to be Texas A&M, one of our rivals? So you going from Michigan State and going to Michigan, how was that?
Yeah, it's funny because with being in the Big Ten sports and everything, if it's Michigan versus some other team, as a dental student, we still had like tailgates and a lot of school spirit. I would obviously be rooting for my dental school, but when it came time that they were playing each other, I rooted for my undergrad. That's where my true allegiance lies, of course. Some people are a little more hardcore where they're rooting for Michigan's failure. Some of my
Yeah.
peers that came from the same undergrad as me, and I'm like, oh, that's unnecessary for
Yeah.
me. I'd like to
Well,
see everyone succeed if possible.
well, it could have been worse, right? You could have gone to Ohio State and had to go to Michigan. I think that I don't know if you had any classmates that went to Ohio State, but I'm sure that was kind of rough for them.
Yeah, when it comes to the getting walking around in your dental school apparel and people say go blue, but you are a fan of another school, it does get hard. But people we got to be proud of both and the different life phases that you're in.
Absolutely, absolutely. So now, speaking of a different like phase in your life, you're practicing dentist now, right? Again, you said 3 or 4 months now. Let me ask you this, and again, hopefully, or maybe, some of the doctors you work with, maybe they'll be watching this, maybe they won't. But I want to ask you, and I want to get a truthful answer here. Um, Being a practicing dentist, was it everything that it's cracked up to be? Is it something that you expected, or is it something that you're like, no, I did not expect this at all?
A little bit of everything. I'm super happy, generally speaking, where I'm at. I think through the first couple weeks, there's highs and there's lows. And now a couple months in, things are definitely a lot more steady. And the issues or things that I was struggling with the first couple weeks, looking back now, I'm like, it's no big deal now. But in the moment, it can be a lot just getting used to new systems or just the amount of procedures that you do in dental school compared to real life is just night and day. And I literally looked and I did as much dentistry in dental school as I did in 2 months of practice.
Yeah.
It's like a
I can.
little scary, 2 years to 2 months, but
Oh yeah.
I'm fortunate that my practice is very supportive. They fill my schedule. I'm busy. I have a great team. There's other doctors there for me to learn from. It's really the ideal situation. And because I had so many great conversations with dentists throughout school, I really figured out what I wanted in an office and I made sure to find an office that had everything I was looking for. So, in that regard, I'm very happy where I'm at. Whereas I have some peers that are maybe struggling in their first job with the office itself, let alone the struggles that come as an individual with being a new dentist in the field. There can be even more headaches outside of the clinical aspect of things.
Well, no, I totally agree, and that's why I just love what you're doing right now because there's other new grads, right? There's other people who are about to graduate. Here's in dental school, and of course, older dentists, we can give our 2 cents and whatnot, but I think someone who's closer to where they are, someone like yourself, it's so important because again, like when I graduated, it's totally different from when you graduated. I graduated back in 2007, worked as an associate, and I opened my practice during the real estate crash. And so when people are talking about, well, what about opening the practice right now? I tell them, I was like, well, the only similarity we had is that you're opening like a few years after the pandemic. And honestly, even though it's been almost 4 years, it's still kind of fresh in everyone's mind, right? And you're always wondering in the back of your head, is something like that could happen again. And I tell them, look, I mean, I went out of the real estate crash, and what I can tell you is life just moves forward, right? You just got to put one foot in front of the next foot, and you can't predict anything, but there's certain sound business principles that you need to have when you open a practice. That's another episode. I'm looking forward to that when you get to that stage because that's going to be very interesting as well. I could definitely give you some tips there. But let me ask you this, as far as, just a couple of months doing all that dentistry, what about the things that now you can see, well, I wish they taught us that in dental school. That would have been super helpful. What are some of those things?
A lot of it is the non-clinical skills, those communication
Oh,
skills
yeah.
and being able to listen to a patient and have figure out what is going to motivate them to find value in what you're telling them that they need for their health. That's like the biggest key you have to figure out. And it takes a long time and a lot of practice, and every person's different. Some patients are a lot harder to get through their minds than other people. So that's like the biggest thing I'm working on in my office. learning from the other doctors that do such a wonderful job at it at this point, but really trying to listen to patients and understand how did they come to be in this state? What are their goals? And maybe if their goals aren't as big as they could be and should be, and maybe they don't see their own self-worth to put money towards being able to chew, being proud of their smile, or they think they put themselves in this situation so they don't deserve a way out. They might just have very negative opinions about themselves. And we almost have to be like their therapists and help them through that and help them realize that there's so much value no matter what their age is, and restoring their mouth and getting disease out of their mouth and everything that we can do for people from little to small things. So I feel like that's the biggest thing that doesn't even come into play in dental school. It's just patients come in, they know it's more affordable. They know they're going to get a couple teeth fixed and then they go. They don't let you take on big cases. They don't let you do any like real transformations for people. It still can be very gratifying in school because you are getting people out of pain, but it's not at the scale that's possible outside of school.
Well, and I'm so glad you brought that up because, when you're in dental school and you're thinking about, okay, I'm trying to get out of dental school, I'm trying to do all my procedures, and we're so focused on the clinical stuff, like, okay, I need to get this down, I need to get this down, and then you're trying to think 3 steps ahead. Like, okay, when I get out, I want to get really proficient in clinical dentistry so that I can take care of these patients and make the money I want. But really, like I always tell new grads or dental students, I was like, look, make sure you become like a really good communicator. And they're like, oh, okay, talking with the patient. I was like, no, not just talking with patients, talking to your team. Like, put the effort in to understand how to communicate with not just a certain type of people, like everyone. Everyone has their different skills. Everyone has the different ways to communicate, verbal, nonverbal. And so I love the fact that you brought that up, because for those who are listening right now, and maybe you're starting off your career, maybe in the same stage as Dr. Haley here, or maybe you're about to graduate, put some effort into the communication, right? Read some books, actually go out there and communicate with people. I know like my wife is a dentist as well, and she's an introvert. And I would say like from when she graduated to now, like her communication skills have really elevated because she realized that, yeah, I may be an introvert, but there's certain things that I need to do to be able to take care of my patients, and that is communicate. So I love the fact that you brought that up as one of those skills that you need to learn. Now, speaking of going back in time here, let's talk about when you were in dental school. For those who are like watching right now and they are in dental school, what are some survival tips you can give them? Now, I can give you guys some, but it's been like almost 20 years since I've been in dental school. But for you, since it's a little bit fresher, what are some survival tips you can give our dental students who are listening and watching right now?
It can be so overwhelming in dental school, certain days, certain weeks. It can be so much burden and stress and just anxiety all around. But I think the best way to deal with that, and it's going to help you in other parts of life too later on, is figuring out and making sure you have a really strong answer for like, why are you doing this? What are your goals? And realizing that dental school isn't just happening to you and you're in this situation and it's awful and you can't wait to be out, but trying to reframe your mindset of remembering how much work you put in to get there and having gratitude for the opportunity to be there. And also recognizing that you are there and you're in control of what's happening every single day and how much you get out of what you put in to the dental school experience. So not just sitting in lectures and trying to get every answer to every test question right, but talking to different faculty and learning about what they have done in their careers, their, again, successes and failures, their clinical tips. Being really involved in student organizations was huge for me. I really tried to supplement what was the general curriculum to things that would support my personal goals. So that was different leadership skills that really helped me with communication and future team motivation in a dental office and everything, but also learning a lot about the business side of dentistry through those extracurricular activities. And not only did that give me a lot of knowledge, but it really gave me a nice outlet from school because it gave me something to look forward to. Maybe there was an event at lunch or a mixer at the end of the day that helped me have a little bit more structure in my schedule so that I didn't just have, when I'm back from school, I should study at some point. It's okay, well, I know tomorrow I have this all night, so I need to study tonight. I feel like setting your schedule a little more full is usually helpful time management wise. At least for me, it was. Having things more structured forces you to be productive in the time that you have to study rather than just leaving it all up in the air and I'll do it at some point. So having a clear goal, trying to make sure you're setting your dental school experience to get you to that goal. And then time management wise, I preferred to be a lot more busy, hence podcast clubs and everything on top of dental school.
Well, again, like I love your answer there because I think when you're in dental school and even like when you're in college, you're focused on that goal. When you're in college, you're focused on, okay, I need to get into dental school. Like that's it means everything to me. And so you sometimes if you're just so focused on something, you kind of miss the actual experience that you get. So I'm gonna tell you something, like as someone who just graduated from dental school, and of course, people who are in dental school right now, you're in that one phase of life. And then once you get past that phase, hopefully you don't ever go back, right? But for the most part, you never go back. And so there's certain things that as a dental student, you'll only get experience in that moment of time. Kind of like, if you're not married yet and you have this moment in time, and if you don't have kids, you have this moment in time. And when you have young kids and medium age kids like I am going through right now, you have that moment in time. And so I love that your answer is so mature, right? It's so mature because like you're in dental school and you just want to get out. You're like, I just want to get out of here. I just want to be a dentist. I want to start making money. But those experiences, you're never going to live those again. And so I love the fact that you were very present and took advantage of those things because now you're definitely in a different season and you probably keep up with your friends, but it's really hard to do. I kind of miss those times where, I used to go play table tennis with my friends. We had like this ping pong table downstairs, and in between studying, we would go do that. And well, now those same guys that we used to play ping pong together with, they have kids and maybe see them like once a year, maybe not to depress you, Haley, not to depress you, but like, when you have families and stuff like that, like I literally just see them at like a dental conference, so such a mature answer, but so true. So I appreciate you just bringing that up and reminding me as well. What does the future hold for Dr. Haley Schultz? What's your, I'm sure you've given some thought. What are some kind of like near future goals that you would like to accomplish, and what are some kind of long-term goals?
That's a great question. And it's a good follow-up to what we were just talking about of trying to be present in the stage that I'm in, which is something I'm really focusing on, enjoying this time. Newly, I guess not that newly anymore, engaged and planning a wedding. We're looking into maybe buying a home in the next year or two, things like that. So lots of that early family building kind of stage of life and early in my dentist career. But as for professional side of things, again, something I'm so grateful for my podcast for throughout dental school and those student organizations is it allowed me to talk to people that went in many different avenues in dentistry, with being a solo owner, being in like a group practice, maybe being with a DSO model, all these different options. And I was able to decide that for me, from what I can tell for now, I don't think the solo ownership pathway is the right one for me. But going into dental school, that was really the only thing I thought would be a good option for me. I really thought, oh, why would you share with someone? That seems like such a hassle to get everyone synced up. It seems like it would be a big pain. I'd rather just do it all myself. And I always had an interest in running a business of some kind. But now that I'm on the other end of things and towards the other end of dental school, I really realized I'm interested in a partnership model or potentially staying an associate long term because I have opportunities to run a business that's not a dental practice, given social media, podcasting, all of that. I really am very passionate about mentorship. So that's what I was interested in with owning an office. I didn't even want to own one office. I wanted to own multiple offices and mentor associate dentists. That was kind of my vision I had going into it. But I realize now that I don't necessarily have to be a practice owner to mentor associate dentists. There's so many different ways you can do that. It can be clinical, it can be communication skills, treatment planning skills. It can be so many different things. So I imagine life will take me in some direction in that regard. Might also have partnership in an office, might not, but I don't think I'm just going to be walking into the door of an office with my name on it every single day. So it's very interesting how your goals can kind of evolve as you go through life and learn more about yourself and about as different opportunities come up. Because never say never. You never know what's going to happen. And I'm trying to prepare myself financially in case some kind of opportunity comes up and I change my mind. So I'm trying to make smart decisions as if I may want to buy a practice in a couple of years. So we'll see.
Yeah, well, you definitely have a lot coming up, so you're definitely not going to be bored. That's for sure. I mean, really excited about you going into that next phase in life because, again, just what we talked about earlier, you got to cherish all those phases, right? This phase right now, and then you're about to go to the next phase with your fiance, and et cetera, et cetera. It's exciting stuff, but just try to enjoy those little phases there. Let me ask you this, and I forgot I should have asked you this the first thing. Look, you look really young, right? And I'm sure people say that all the time. How often does this happen where someone walks in, they're like, "Where's the dentist at?" Or they wonder if you're the dentist. Does that happen very often with you?
No, and
What?
I was expecting it to be all the time. And it's
I would have
interesting.
said that if you were my dentist. I mean, I would walk in. I'm like,
Yeah.
"Hey, where's your mom at? Where's your dad at?" Or
I
something.
know. No, everyone at this office, again, I don't know, I've seen hundreds of patients in a couple of months, whether it's hygiene exams or operative
Yeah.
work, whatever. And I've only maybe had like 4 people comment on the fact, like, oh, did you graduate recently? Or like,
Okay.
may I ask how young you are? Like, you look so young. But only a couple people. And even then, they're all not asking it in a like, oh, you probably don't know what you're doing. For people that find out that I graduated recently, they all seem excited. They all have a really good impression of the University of Michigan as a whole. So they're like, oh, you must be like really fresh on your game. Like you just learned all this stuff. Like they have that kind of really nice attitude, which I wasn't expecting. And then as for the age, people are just excited about it, or they're like, oh, I don't see female dentists that often, or wow, good for you that you're like already a dentist at this age, like my kids are older than you, that's crazy. Like they've all been really supportive, which is so surprising. And I expected more resistance or people
Yeah.
that would not maybe want to be on my schedule, they'd want to be with one of the other doctors, but it's been really, really seamless. And I think a lot of that's because of the team at the office. I'm their second associate they've taken on, so they've kind of gone through this before. There's a couple doctors at the office, so patients aren't really tied to one person at this point, which is also helpful. And the team really like hypes me up before they schedule with me or when I'm coming in to do an exam and meet someone new. So all of that together, I think, really makes it where it hasn't been a problem.
Well, I have to tell you, you are extremely lucky that you're in
I
such a
know.
supportive environment. Because I remember like when I started in some locations, I worked at a kind of like a corporate dental practice. Some of the locations, I was the only dentist there, and people were like, "Who are you? Like, you look like, are you the assistant or something? You look really young." So the fact that you have this really supportive environment is again, that's something that for those who are looking at the right associate positions, I mean, would you say that's probably, of course you want to be busy, of course you want to do all the procedures, but wouldn't you say like having this supportive team and a supportive environment probably is ranked up there as one of the most important things?
Yeah, the team is really everything, and their attitudes towards an associate coming in and their general, how much they like their job, how much they want to be there is just
Mm.
huge because it makes you enjoy being at work. And even if it did take a little bit for my schedule to get full, which it really didn't, but if it did, I would not be upset because I know I'm in a good place and I know that they're working to fill it. But again, just because they are just so good at what they do, it hasn't been any problem with the transition and keeping my schedule full and everything that we've talked about. I think it's just so important that it's a practice that's stable and steady and people have been there for a while. They like being there. They're committed to the office. They're committed to the values of the office, and the mission is huge. And it's hard to find that. That's not everywhere, or maybe those places aren't always hiring. So you have to do some searching. And I mean, I'm working in a town I've never heard of before. It's tiny, tiny town, like 2,000 people, half the population's Amish. And I wouldn't have known it even existed if I didn't happen to get connected through some dental brokerage website. But you have to kind of do some digging to find these like hidden gems of offices sometimes. And you have to maybe be willing to
Have
move.
an
I
open
moved
mind,
like,
right?
yeah, I moved like 3 hours from my family, which isn't terrible. I think it's perfect. I love where I am. It's not too far, but you kind of have to be willing to spread your wings a little bit and try something new.
And if you're looking for like gifts like Amish furniture and stuff, you're in like the perfect place to get it for
Yes.
people. I love that. I love that. Now, I can't have someone like you who, a young dentist who is just has this entrepreneurial spirit, right? Who's looking to get involved in so many things. I can't have someone like you on my podcast without asking you the Entrepreneur 3 questions. And so I'm going to start with the first one. We're going to segue into that. And that is give us like a productivity, like a tip, something that you do, or it could be like a tool, app, anything like that, that keeps you really productive and efficient that could help someone else out.
So this is something I have to challenge myself to do. It's not easy, but when
Okay.
I'm doing it, I am much more productive. So I really try my best to be 100% present in the thing that I have decided I'm going to do in that moment. And it's not easy. So let's say I'm at work, I try to be fully present at work rather than, okay, I'm waiting between patients. I could just go and scroll on my phone or something, but I'm trying to challenge myself to review the cases the other doctors are doing on my computer and then maybe be like, oh, hey, why did you do this? Or what did you think through for this? Or walk into another operatory, see what's going on, try to just continually be learning when I'm at work, which again, it's not always easy. You get tempted otherwise. You get tempted to kind of just sit back and relax when you have downtime, or if I'm working on my podcast, or if you're a dental student, things like that. And I have a very I guess the more creative side of me and things, ideas pop into my head all the time. So it's hard to not switch gears really quickly when
Yeah.
I think of something, but I kind of brain dump when that happens. I'm very heavily rely on the Notes app on my iPhone. I just have a running like to-do list and a couple running different lists. And like if I think of something that's a good idea or I think of something I need to do, I just quickly put it on there, but then I go back to what I'm doing. So I don't forget things too much, but I really try my best to be 100% present in each thing you're doing. That way it's getting the attention it deserves. And then you can kind of turn that off when you go home or when you go to the next thing.
Now, do you have that same philosophy when you're spending time with your fiance?
I try. Yes. I feel like, again, it's not easy. It's a
It's
challenge.
hard. It's hard. I try to
Yeah.
do the same thing with my family, without thinking about like, hey, what do I got to do next and whatnot. And sometimes my wife will like tap me on the shoulders, like, hey, you're getting that like 1,000-mile gaze, like where you at? You're physically here, but you're not here. I'm like, oh, I'm so sorry. Yes, 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 I'll order that or something like that. So again, you're doing something that is so important, not only just for your business career, but as you move along in your personal life, super important in your personal life as well.
Yeah, it's something I admire that I've heard from other people. And again, I'm not perfect at it, but like that is what I aspire to. And I try to catch myself when I'm falling short. And I think it's something great for people to work towards.
I love it. I love it. So the next question I'm going to ask you is, I'm a big fan of like reading and also audiobooks as well. And for people who want to level up, I mean, you're going to have to learn from somebody, right? So whether you like to listen to books while you're driving or running or whatnot, or reading books, what is like one nonfiction book that has really affected you in a positive way and that you would recommend to others?
So when I knew I'd have to be recommending a book, I had one in mind, but then during this episode, our
Yeah.
conversation topics made me think of another one. So I'm going to give
Okay.
you two. The
Okay.
first, the first one that helped me again with setting my intentions for my life and how being a dentist is going to fit into that and what I want my career to look like. It's actually Dr. Alan Stern's book, Enjoy the Ride. I really, really like that one. So I highly recommend that for people that are earlier in their careers, or if you're kind of at a plateau or just struggling. He goes through his own story, but he shares a lot of things that you can reflect on and figure out what you want your story to be. And then the other book goes with all the communication things you were talking about. And it's one that the owner doctor at my office gave to me. And I believe it's called Exactly What to Say. I don't know who the author is, but it's only like $5 on Amazon. Short little pamphlet book. And each page is a different saying that you can ask people or phrase you can use. And his challenge was just open a page each week, read that, and then try to say that as many times as you can that week. And then eventually you'll have a lot stronger communication skills, like removing the word just, like, oh, I'm just going to take an x-ray, or it's just a small crack on your tooth. No, it's a crack on your tooth. It's a crack on your tooth. You need a crown. So like, it's very easy for us, I think, especially new dentists and probably female dentists, to kind of undersell things. We don't want to upset people, or we don't want to, we're just scared. I don't know why. Again, it probably mostly a new dentist thing, but just being too timid with our terminology and our phrasing when we're talking to people. So that book is a good way to call yourself out on things that you could be saying better, and actual tangible phrasing you can use to replace maybe what you're doing.
Well, two books that you recommended that not only is good for like the actual person who's listening to this, but possibly their team as well. I actually looked over here because generally I have Dr. Stern's book like actually right over here, and I have a few other friends and their books normally there. I kind of flip through it. And so it's actually up on my bookshelf. So I was like, darn it, I was going to pull it and pull it up here, but it's over there. But yeah, highly recommend that as well. Two great books there, not only for yourself, but for team members. It could definitely benefit team members as well. I'll have to definitely look on that second book you brought up. Now the last one here, again, for me, sometimes it's hard because I've made so many mistakes in my lives, but share like one mistake that you learned something really significant from that actually could help somebody who's watching and listening right now.
This came to my mind as well from the conversation we've been having. It just kind of keeps snowballing. But the mistake that I kept noticing in myself the first couple months of working, and I'm still surely not perfect, but is the way I was addressing patients and treatment planning and showing them photos and things. It was the terminology that I would use, or it was being kind of passive when they ask a question such as, well, how much does that cost? Because our structure is like, we have a treatment coordinator, if you'd call it that, and they're going to handle the finances, and they're going to set up a payment plan, and they're going to make it work. So we kind of just toss it to them at the end of the appointment. So I was using that as an easy out to be like, oh, well, so-and-so is going to help you with that when we're done, rather than being more comfortable with the tension of addressing that conversation and saying, like, just out of curiosity, if it's more than you were expecting, do you still want to get this done? And that kind of goes back to tell you, did you do your job of making them find value in the crown or the aligners or the filling, whatever it is? And if they say, honestly, like, if it's too much money, I'm not going to do it, then you need to circle back and figure out again what is holding them back on a deeper level than just the dollars, because there's so many different ways to make that work with payment plans and things. If people really wanted it, like they might want that coffee in the morning or whatever, they would make it work. So I think for me, it's just noticing when I'm being too passive and not willing to go into that conflict and challenge myself, because the more that you do it, the better you are at it. And again, I notice the owner doctor in my office is so great with this phrasing and the way he can just communicate with patients. I'm always trying to level that up a bit, but that's a mistake I'm consistently making with talking to people. Is, oh, I should have said this differently or something like that. So really, really working on those communication skills is huge.
Well, I'll tell you what, the owner doctor, the practice you're at, I'm sure he's had a lot of practice, much like most of us. And the great thing about dentistry is that the more you do it, the better you get, right? Whether it's like, I hate doing class twos or I hate doing endo. You do enough endo, you're actually going to get good. You have enough of these tough conversations. You have enough times where you're actually having to address some of these objections from patients, you're actually going to get better. You just get better by just doing it. And so just to let you know, there's still a lot of us that are still working on those things, right? This is kind of like one of those, hey, I want to be a better, I want to eat healthier, right? Like that's like a never ending journey, right? Like I want to eat healthy, right? This is one of those things as well, but we just kind of keep on going up, keep leveling up. So thank you so much for being vulnerable there and sharing that, because there's so many people who probably are feeling the same way. And again, I want to take this time to thank you, Haley, for jumping on, because honestly, you kind of like inspired me as well, as someone who's kind of been going, been in this career for a long time, and just hearing your stories about what you're going through when early in your career kind of reminds me of that. I'm like, wow, I need to take a second just to sit here and just kind of look at everything that I've accomplished and really appreciate that, because not too long ago, I was kind of like in your situation too. So thank you so much for reminding me about that, but also for all our younger dentists who are looking at all these people are doing all these things, and you just want to get there as quickly as possible. There's a process there. And look at what Haley's doing here. And she's saying, look, kind of enjoy this little journey. And so I think that's a good story as well. So Haley, for those who want to reach out to you, who want to ask you all these questions, who want to say, hey, I got things that I want to do too outside of dentistry. Maybe they're looking up to you and they want to learn those things. What's the best way to get a hold of you?
Probably Instagram. So it's Dr. Haley DDS, Dr. Haley DDS, Haley is how I spell my name, is the best way. I also have an Instagram for the podcast page, but if you want to send me a message, probably just on my Dentist Haley is the best page to reach out.
Okay. All right, great. And we'll have that as well. And I'm kind of old, so I actually reached out to Haley via Facebook, but she likes Instagram. We can do that too. But I reached out to her on Facebook, but again, I think that's more of her accommodating like old guys like me and Dr. Stern. So Haley, thank you so much for jumping on. We appreciate it, guys. I want you to, if another way to follow her as well as the Dental Download podcast. She has a lot of great episodes on there. So that's one way as well. And of course, I'm sure you can message there as well. Haley, thank you so much for jumping on. Guys, thanks for tuning in. See y'all next time.